just so that I have it. A Good Place Therapy is a bi-coastal practice. We offer psychotherapy for adults, couples, children, teens. We have offices in downtown Manhattan. We have an office in San Francisco and an office in Palo Alto. And we also still do see clients virtually if that's something that they request. We implement evidence-based practice modalities such as CBT, mindfulness. We see a range of clients who are dealing with issues such as trauma recovery, eating disorders, reproductive and maternal mental health, anger. We do premarital and couples counseling. We see LGBTQIA clients. We have really a broad spectrum of specialties from our 24 clients on staff, which is really wonderful. And most recently, we've brought on Annie to join our team, who focuses on child development. So she works with children as a child life specialist. She works with children who are undergoing life transitions, which she will speak more to. This specific series we created a few years ago during the pandemic. At the height of the pandemic, we saw that there was just a big need for people who needed more resources and needed more mental health support. So this is a free resource for anyone, whether it be clients or people to the public or family and friends. Anyone can join. We try to do it once a month, and topics cover a wide variety of themes related to mental health and well-being. The mission is really to increase mental health awareness and reduce stigma through education. So we post these up on our website. Anyone can share them with anyone else. You know, some people don't have health insurance to see a therapist. Some people can't pay out of pocket. So this is a real way that we want to be able to facilitate people to seek services at no cost to them. And we're so thrilled that we have therapists and now Annie who are willing to take the time and effort to, you know, share their expertise. So thank you, Annie, and I will hand it over to you, and you can kind of give us an overview, and we can continue on the presentation.
Sure. Thank you, Daniela. Let's get started with the session overview. So here's just a general list of what we're going to cover in this session today on a general level. I'm going to start with an introduction to child life for those who aren't aware of child life services or what we as child life specialists do with kids and families. I'm going to talk a little bit about stress and the way that it impacts children through their developmental levels. I'll then go on to talk about supporting children at different ages and stages through stressful events. And then talk about some concrete everyday skills that parents and caregivers can utilize that are rooted in child life theory. And then lastly, I can talk about how to connect with me if you're interested in pursuing some work together. So Daniela, thank you for that awesome introduction. To go into a bit more detail, my name is Annie Levinson. I'm a certified child life specialist practicing here in New York. I have a master's in child life from the Bank Street College of Education here in New York, and I have about 3.5 years of experience working in pediatric healthcare settings. Recently, I've transitioned to a more dynamic role here with AGP, with my goal being to bring child life services out from the hospital into the community. And I'll talk a little bit more about that next. So some of you may have heard of what a child life specialist is. Some of you may have no idea what a child life specialist is. By definition, a child life specialist is a psychosocial care provider. We're traditionally employed in healthcare settings, most often children's hospitals, hospice centers, or outpatient pediatric facilities. Like I was saying, there's this movement now to bring the expertise of a child life specialist out of the hospital and into the community. When I meet parents in the hospital, so many of them find benefit when they're working with a child life specialist and their child, and they wonder, where can I access these resources once I leave the hospital? How can that be done? So now there's this push to bring that expertise out into families, homes, into the community, into schools, into areas beyond just the four walls of a hospital. Because there's not just important child life work that can be done in the moment, in a hospital setting, but there's work that can be done prior to a medical experience, after a medical experience, throughout a child's life, beyond their in the moment hospital experience. And just to draw, a quick line of distinction between my role and the role of a therapist, though I, as a child life specialist, cannot make diagnoses, what we do is we help parents and families navigate stressful life experiences. I can provide developmentally appropriate education and activities to help really kids contextualize and process difficult or complex information or life events that they're experiencing. So now to go a little bit deeper into the meat of this presentation, kids and stress. So as a certified child life specialist, really what I'm trained in is recognizing signs of stress and really delving into the way that it impacts children at all ages and stages. I'll go into each developmental age and talk about some potential signs that a child of that age might be experiencing an acute level of stress. But on a general level, here are some important things to note about the way that kids experience stress, and when you're looking for signs of stress in your child. The first is that every child is different. Every child has a different level of stress tolerance. This level of stress tolerance ranges and changes, sometimes in a day. And that's just something to note when thinking about the way that a certain event might be impacting your child. Stress and information processing. I talk about this all the time with parents that I meet, but it applies to kids as well. When we are stressed and something is bothering us, or we're dealing with something that is outside of the realm of our norm, our ability to process information and hear what people are saying to us and act is dampened. We can't properly do what we need to do. We can't properly hear what people are saying to us when they're saying it to us. This goes for adults, and this goes for our children as well. Beyond the fact that children don't necessarily process information the way that adults always explain it to them, if that child is stressed on top of that, it'll just create even more of a gap in communication there. Next is risks associated with experiences of stress at different ages. There are critical periods in children's lives when a stressful experience can really follow them and create larger issues down the line. So to really, kind of going into this next bullet point here, to really know about the developmental age of your child, where they're at on a developmental level, cognitively, language-wise, language processing, just to know where they are on a developmental level will help you more effectively communicate with your child, more effectively understand them and their experience of the world, and ultimately ensure that they feel supported from you no matter what. And lastly is that you know your child best. Like I said at the start of this slide, different kids have different levels of stress tolerance, and nobody knows that in an individual child better than the parent or the caregiver who spends the most time with them. You know your child, you know what is stressful to them, you know how they're going to behave when something stresses them out. And this is just something to note going forward, that you know your child best. So now I'm going to talk a bit more about recognizing acute stress in kids of different ages. And when I say acute stress, I don't mean just a quick, like a hard day, a tough day, a bad day at school, a bad test grade. I mean, your child is experiencing stress in heaps, stress in, piles and piles of stress at a time. And these are just some general ways that you might be able to recognize an acute amount of stress in your child that ultimately might mean that they need some extra psychosocial or psychological support. So beginning with infants, I have anxiety here as a bullet point for infants, and I think that that can kind of take people aback sometimes. How can an infant be anxious? Um, really what that's rooted in is their developmental level at the time that they're an infant. At this stage, what they're working on developmentally is forming attachments, forming bonds to their caregivers. When an infant is impacted by a large amount of stress, this can result in anxious attachment, avoidant attachment, insecure attachment styles with their caregivers that could ultimately yield some huge negative impacts for the rest of their lives. Whether that's, them thinking that their caregiver is, not trustworthy, not dependable, not around as often, or they're hyper attached to their caregiver and really have a difficult time with any amount of separation. We can see this in infants sometimes when they're introduced to large amounts of stress. And also delay of developmental milestones. This is something that lots of parents educate themselves on when they have a newborn and an infant. But this is something definitely to keep in mind if you are experiencing a stressful life event while you have an infant in your home. Just something to keep in mind and keep, aware of. And something to definitely consult with your doctor if you have questions about your child's developmental milestones. So moving up through toddlers and preschoolers, here we have some bullet points of some things that might clue you into your child experiencing stress. Regression is a term that we hear associated very often with this age group, toddlers and preschoolers, as well as tantrums. And when I say that these are signs of acute stress, this is when I hearken back to the phrase I was talking about before, which is that you know your child best. When I say regression, I don't mean, they had a slip up and they had a potty accident. I mean, it's a consistent turn and it's something that you had previously worked on and it was down pat and, my kid is potty trained. And then all of a sudden something happens and then they're back to square one. And when I say tantrums, I don't mean, today was a rough day, she was on the floor for 4 hours and I just couldn't, it was rough, but that kind of thing has happened before. I mean, this wasn't typically something that would stress my kid out and now it's stressing them out. And I can tell because these tantrums have just seemingly come out of nowhere. Same with these other behaviors here, despair and withdrawn behavior and some extra aggression, especially aggression towards the caregiver. You have to think about what do your child's reactions to stress typically look like? Is this reaction you're witnessing out of character for your child? If some of these things have suddenly appeared in the behavior of your kid, that might clue you into your child being stressed, and definitely some things to consider. All right, I'm going to move forward into school age. Regression is something that we can see crop up for this age group as well, if they're feeling stressed. Maybe their behaviors suddenly look a little less like themselves or less mature or just kind of off to you. And then this inability to complete tasks and frustration. At this age, with our school age children, they are creatures of, doing. They just want to contribute. They want to be active. They want a job to do. If you know that about your child and then suddenly you see they have an inability to complete some tasks, they're easily frustrated by tasks that were previously no big deal for them. They're asking for extra help in areas where that they don't really need help with that. That might clue you into some levels of stress there. Withdrawn behavior and displaced anger. This is kind of when we start to see experiences of stress in children mirroring those experiences of stress that we have as adults, feeling withdrawn, displaced anger, something that typically wouldn't get your kid upset all of a sudden is just throwing them off, and they can't calm down, they can't cope. This is something we see in adults. How often are you, you know, uh, just totally stressed out by something that shouldn't really make you that upset? Oh, the grocery store didn't have, the kind of milk that I needed, and that's just throwing my whole day off. It's not really about the milk. You've probably got something else going on that's bothering you a little bit. We see this in kids as well. Their anger is being displaced from other areas that they maybe can't control in their lives, to something that doesn't seem, it doesn't seem right. Um, so that's what we see in our school age kids. And then, that mirroring of reactions to stress in children or in adults, that continues even more when we get to working with teenagers. This is when we start to see behaviors that we can generally acknowledge as behaviors associated with anxiety or with depression, or some, withdrawing from socializing with friends, with events. This can kind of clue us in to stress in adults, and definitely is something that we see as a part of a behavior in teenagers as well. Yeah, so moving forward, these stressful events, when we talk about things that are stressing our kids out, what are these things? This is just a quick list of some things that come to mind when I think of stressful events or life changes in the life of a child. So here are a few, but every child is different, and so many factors can go into how any given child will cope with one or many of these events being introduced into their lives at once. What might be stressful for one child may not be stressful for another child. And these factors that can contribute to whether or not this event could be experienced as super stressful, these factors are myriad. What does that child's support system look like at the time of experiencing this event? What's going on in their lives developmentally? Are they experiencing one of these things at a time, or are they experiencing multiple? We often hear this phrase, children are resilient. And that is so true. Historically, children have shown us that they are capable of bouncing back and growing and developing in the face of all kinds of challenges. But just as we learn that children are resilient, it's also important to note that the biggest predictor of success in the face of stress and adversity is a support network and supportive caregivers. So when we think about that, what it means to have a supportive caregiver in a time of stress, we can move forward to this little exercise. So when you're thinking about providing support as a caregiver, your child is experiencing stress, and that in turn makes you stressed. And that can impair your judgment, impair your ability to properly support them. So I have this imaginary scenario here. It's no secret that even the most normal run-of-the-mill wellness checkups can be nerve-wracking for a child, and in turn can be nerve-wracking for a parent. So let's imagine you're bringing your child to a wellness visit. You're almost to the end of the visit. You've done the vital signs, they've measured your child, done the temperature, the blood pressure, you've gotten through all of those hoops. And now the nurse comes back in and says, you know what, the doctor would just like to run a quick blood test. We can do it right here. It'll be super fast, just with a quick butterfly needle. And immediately you jump to the fact in your brain that a couple months ago, there was a similar blood test that had to be done in this doctor's office, and your kid did not cope well. And it was really tough and just really difficult for everybody involved. Your child was crying, you were crying, the nurse was crying, everyone was upset. And today, that this blood test is going to be important for your kid, and that you need to move forward with this test. So let's think about how you might be able to support your child in this moment. So here are some general things to keep in mind before I go into some specific ways you might support a child of a certain age. This first one, your reaction. Internally, your reaction is going to be what it's going to be, right? You can't control that. But how you can behave and what you can do in that moment can really make or break this experience for your child. Maybe your kid is the kind of kid who who heard this and feels it immediately, and before you can even get a word in about it, your child is already, off the wall and freaking out. What do you do in that moment? Maybe you ask the nurse to step out while you just talk about this with your kid, talk about how, this is unexpected. You didn't have to, you didn't know that you were going to have to do this today. But thinking about your reaction and the way that your child might be feeding off of that, or will definitely feed off of that. If you lead with, this is ridiculous, I didn't know we had to do this, I can't believe we're going to have to go forward with this, that clues your child into the fact that you're stressed, so they feel the need to be stressed. Next is honesty. Maybe your child didn't hear exactly what the nurse said, but now's the time to be honest with your child about what's actually going to be happening for them. Speaking in clear, concrete, direct words with your child in a way that they'll understand. Here's what we need to do. I know it's not fun, but we need to do this, and explain it's a needle, it's a blood test, and you can be honest and say that it's over and it's really quick. But you can also be honest in saying that it is a needle, and talk about what it's actually going to entail for them in an honest way. The next thing I have here is to collaborate. And I mean collaborate both with your child and with the medical team in the room. Think about what it is that your child actually needs. Talk to them about how this can be made easier for them. Talk to the nurse about what their suggestions are, what they have seen work better in the past. You have time to pause, to think, to make a plan. And that kind of leads into this next bullet point, to advocate. I cannot say for sure that every single member of every pediatrician's office will be so pumped to have you utilizing child life skills in the moment. But I can say that, medical teams respect and should always respect a parent who's able to advocate for their child, and a child who's able to advocate for themselves. But if you can advocate in this moment and you can find it within yourself to push for some space, say, you know what, let me take 5 minutes with my kid, let me talk to them, we'll make a plan, and then I will come back out and I will grab you speaking with the nurse. Or, maybe in this moment you feel that you can advocate for some pain management techniques. Sometimes ice is used to mitigate some pain during a blood draw. There are other methods that I'm more than happy to talk about to mitigate some of this pain during a blood draw. And that kind of goes along with looking for solutions, and collaborating. Talk to the nurse, say, what can we do here? Talk to your child, say, what can we do here? How can we fix this? We have to do it. So what can we do to make it easier? And this last one, arguably the most important, to validate the feelings that are coming up. Your child is upset. You know that they're upset. Tell them that you see that from them. I know that you're upset about this. Allow your child to be empathized with, to feel seen, to feel heard, to feel acknowledged. And then go forward and say, I see that you're upset. This is something we need to do. And then go back to looking for solutions, thinking and collaborating and planning. So let's move forward into the developmental stages. So, some of these conversation pieces about talking and collaborating and planning don't necessarily apply to infants. They apply to the medical team that you're working with, but not necessarily to the infant, of course. But there are ways that we can utilize child life skills to support an infant during a painful procedure. And And I say painful procedure knowing that a blood draw is fairly fast and there are more painful procedures out there. However, just as children's reactions to stress are different across the board, children's reactions and thresholds for pain are different across the board. So to call a needle stick a painful procedure, just as I call a lumbar puncture a painful procedure, I am doing that mindfully. Every experience is different for every child. So thinking about infants, the first bullet I have here is positioning for comfort, and this is something I'm actually going to talk a bit more about after I get through these developmental stages. So I'm going to kind of put a pin in that one and get back to it. This next bullet point is to limit stimulation. Oftentimes, babies and infants have difficult veins to find, and that's tough and that's really hard. And it's not fun for the child, for the parent, for anybody involved. But it's kind of great because nurses often like to turn lights off and use flashlights to look for veins underneath the baby's skin. And once the lights are off, it kind of can put an infant in a more soothing environment and limit some of that stimulation that they're getting. Thinking about your individual baby, what helps them calm down, what helps them soothe. Limiting stimulation is usually one of those things, whether it's with white noise, with shushing, with rocking back and forth. Maybe your baby will do better with fewer people touching them. You can kind of become one of those people who does less touching of your baby if there's lots of nurses being involved, although I would almost always advocate for the parent to touch the child if the baby's comfortable with that and it helps them soothe. Do you have a pacifier the baby uses? Is there a blanket you can kind of put near their face that helps them feel comfortable and warm and safe? Do you have a song that you sing to them at nighttime or when they're feeling stressed out that you can kind of whip out and utilize as a tool here? I would almost always say that less stimulation is more for a baby. So if you have a white noise app on your phone, it's a really good one to use in a situation like this, especially during vaccinations or blood draws. And yeah, just to think about what it is that your baby might need to calm. And then this last bullet, move to soothe ASAP. This is a time where it might be helpful to collaborate with the nurse beforehand. Say, okay, please let me know as soon as you're finished, and then I'm going to pick the baby up as soon as you allow me to. As soon as that Band-Aid is on, the baby is up and in your arms and you are working on soothing that baby. Maybe they weren't taking the pacifier before. There's a good chance if they take one at home after they're picked up and trying to calm themselves down, they'll take that pacifier again. So think about what you can do to soothe that baby and calm them back down as soon as possible. So moving on to toddlers and preschoolers. Again, I've got this positioning for comfort bullet point here. I promise I'm going to get back to it. But here, a common child life skill that we utilize for needle sticks is refocusing of attention or distraction. Once a child is in a position to have a blood draw done, oftentimes what we as child life specialists will do is try to have the child refocus their attention on me. And that's not to make them forget what's happening or trick them into complying. It's a proven method for helping children get through medical procedures. And it allows them to refocus their attention entirely on something that's comforting to them, whether it is bubbles or a light up toy, a favorite music video or YouTube video. But if you are able to get your child's attention, a toddler or preschooler, and have them engaging with you, singing a song, blowing bubbles, it can definitely be a useful skill in a situation like an unexpected blood draw. And this third one, thinking about your child's history. What has worked in the past? I think I led off this example with saying, you had a difficult experience a couple months ago. really try to pick that experience apart. What was it that was really freaking your child out? For some kids, it's less the actual needle stick and more the tourniquet, or it's less the actual needle stick and more the feeling of being restrained. Um, this might be a time to advocate for, less people in the room, less giving direction. When kids are around this age, if there are lots of medical personnel in the room trying to help, sometimes it can be overstimulating and your child is hearing a lot of directions and a lot of people are trying to get their attention. You try to maintain attention with your child one-on-one. Sometimes kids find that helpful. Think about what's worked for your kid in the past, is really helpful. So moving up through school age, at this age, collaborating is really helpful. Talk with your kid. This is when I would almost always ask a parent to advocate for taking a little bit of time to wait before the blood draw actually happens. Talk, collaborate, make a plan, think about what's helpful. And talk about past experiences. With the toddlers and the preschoolers, you as a caregiver can think back and reflect on those past experiences that were difficult for you and for your child. But here, as kids are getting older, they remember. They can tell you what was hard for them, what was easy for them, what made things more difficult, what lessened their anxiety. These kids are more likely to remember and to be able to be meaningful contributors to this experience. And also at this age, they want to contribute. They almost always want a job to do. So think about what they can do to help themselves in this scenario. And lastly, labeled praise. This is huge in almost all situations, and I try to encourage parents to do it as often as possible. Let's say you're holding your child, the needle stick is all over, and they did awesome. They coped super well, better than you expected. Instead of just saying, good job, or, you're so good, you're such a good kid, you're such a good girl, you're such a good boy. How can you get specific? You did such a good job holding still. You did such a good job telling us what you needed, or even going past praise just to thank them. Thank you so much for staying still. Thank you for using your voice to tell us what it is that you needed. And even if there was yelling or crying involved, what did they do well? You can focus on the positives here and not just focus on the fact that, they cried, which is a positive coping technique in my opinion, and in many people's opinions. You can even say, thank you so much for crying, but keeping your body still at the same time. Really getting specific with these kids on what they did well will not only help them calm themselves back down in the moment, but in the future will help them cope better with other medical experiences, because they might remember, oh, I did this one thing really well, and focus on doing that again. I remember I was told I did such a good job holding still. How can I do that again? So lastly, with teenagers, collaboration is arguably the most important with these kids, not only because they're the biggest physically and you need their collaboration, but also because they have full-fledged thoughts and ideas and concerns and worries that they at this age will be able to communicate with you in a really clear way. Ask questions and allow them to ask their questions of you. These kids might have concerns about why it is that we even have to do this blood draw. Why do I have to do this? Why is this even the thing that I need to do today? Why can't I do this later? Going back to that honesty and talking with them honestly about, we need to do this because XYZ, we need this test to make sure XYZ, and get their input. This is something we have to do today. In the future, how can we make this easier for you? What do you think we could do to make this better? Would you rather get a blood test somewhere else, at like a Quest Diagnostics or something like that? Or would you rather do it here at your pediatrician? How can we make this better for you? Is there something we can bring with us next time to make this easier for you? Maybe they'd like to listen to music during it. And that goes the same for school age kids as well, really thinking about planning for the future. How can we make this better next time? But these teenagers especially, to know that their input is not only heard but also valued. It's really important for them, and just kind of establishing a sense of mastery over this experience. They're getting older. They're going to be soon going to doctors on their own, to establish a sense that their opinions and feelings about the care of their own body are important, will just help them moving forward as they move into adult care in a couple of years. So the last thing I really want to touch on here is going back to this positioning for comfort. Positioning for comfort is amazing. I use it as often as I can in the hospital, and I try as best I can to scaffold parents to utilize it on their own in the future. And really what positioning for comfort means is it's exactly what it sounds like: positioning you and your child and the medical team in a way to make that child as comfortable as possible. So it looks different for children of different ages, and I would say positioning for comfort is most helpful for infants through toddler and preschool ages, and even some younger school age kids it can be really helpful for. So to start at the top here with breastfeeding and swaddling, these two are, of course, more often associated with supporting infants during painful procedures. Breastfeeding is especially helpful during vaccinations. Of course, the timing doesn't always work out, but if you can plan a time to have your child be breastfeeding during a doctor's appointment, it really does help in making them feel safe and comfortable, while also allowing a nurse or a doctor access to that child's body to do a medical procedure. Swaddling can even be helpful up through toddlers. When a child is swaddled, their arms are brought to their midline over here towards the center of their chest. And this is a really helpful position for mitigating anxiety in toddlers. It's something that can even be done if a child is colicky and crying or can't sleep, to bring the arms to the midline and to bring the legs in as well, can really help a child feel safe and just comforted. So to swaddle a child, to have their arms in this position and, one limb exposed potentially, to have a doctor or a nurse access to a limb, that can be a really helpful position to have a child in. And even further than that, as opposed to just swaddling and having the child lay down on a bed, if the child can be swaddled and simultaneously held by a parent or caregiver, all the better. So next is laying down. As I was just saying, not always the first choice, but sometimes with toddlers and preschool age children, medical professionals feel that is the best way to complete a procedure, or sometimes it's the only way to complete a procedure. It's not the first choice, being that there's some research that indicates that when a child is laying down on their back during a medical procedure, their levels of stress are higher than if they're permitted to sit up. During something such as anesthesia induction, we as child life specialists often advocate for children to be sitting up as opposed to laying down, to allow them a sense of control and mastery in that situation. But if a child does need to lay down for a procedure, it's okay. Try to be, as a caregiver, as close as possible to that child's face. And if you're able to, here's some more opportunities for advocacy here as a parent. Advocate to try and lay down with your child. Can you lay next to them? Can you put, your torso on the bed next to them to have your face as close as possible? Try and find a way to be as physically close and maintain that attention between you and your child to allow them to feel comforted. Chest to back. This is just basically having a child sit on your lap directly in front of you. This is especially helpful if a medical provider needs access to your child's face, say for something like a COVID swab or a nebulizer treatment, and can be helpful during blood draws and vaccines as well. This allows your child to be comforted by you physically, but also restrained and positioned in a way to allow the medical providers to do what they need to do. And lastly, here we have chest to chest. This is my favorite position, mostly for vaccines and blood draws. If you can imagine a child sitting on your lap, straddling you, looking to one side or the other. This is a really good opportunity to allow for some refocusing of attention or distraction. If they're looking in one direction and the nurse might be looking in the other direction, at one arm, that child can look over the opposite shoulder and engage in something like bubbles or a YouTube video or a song. This is my personal favorite position for comfort. Um, so I got through a bunch of really concrete skills to be utilized in this imaginary scenario, but also in any number of medical experiences that you may encounter with your child. But here I have just some bullet points on other kinds of work that I might be able to do with you, with your family, with your child. If your child has medical needs, either recently or upcoming, if your child has just general difficulty with medical or dental visits, if your child is experiencing a life transition, such as you're moving to a new home, your child is moving to a new school, your family has a new structure to it, maybe a new parent in the life of your child, a new caregiver, a divorce, a remarriage, something like that. A new baby, another kind of life transition that sometimes parents are looking for resources for how to support their older children with. And lastly, if your family is coping with grief, as child life specialists, we have a background in bereavement and grief support. It's something that we do often in the healthcare setting. And some of our child life skills are easily utilized in helping families cope with the death of a loved one. So with that, thank you. Thank you for your time. Thank you for your attention. Here's some information on how to contact me if you're interested in working together. Thanks.
Thank you so much, Annie. If anyone has any questions, feel free to put them in the chat. We actually did get 1 or 2 questions sent over to us in advance of this session that we can kind of review. And we do have time for 1 or 2 questions. So someone sent in, what age specifically do you work with when it comes to babies, kids, and teens?
Sure. So the work that I do in pediatrics, technically is 0 to 21. However, the work that I might do directly with a child, I would say could start around the age of 3 and go firmly up through teenage years, to 17 or 18. For children under 3, I think the work that I might be able to do with a family could be limited to parent coaching, which is still, some direct work that I am able to do, but just less directly with the child and more by way of interacting with the parents.
Great. One other question we got was, can you dive a little further into what intervention looks like when it comes to children and grief?
Yeah, sure. So as child life specialists, we are educated on what grief and grieving looks like in children of all ages. And really the work that we do surrounding grief and bereavement is around something called legacy building. So if a family is experiencing the death of a loved one, we can talk about that loved one and create some projects to build a legacy and to help remember that loved one who has gone. Legacy building is a big one for us. Another aspect of the work we do is actually explaining and talking about death with children and helping bridge that gap in those difficult to have conversations. If someone in your family has died and you're looking for some resources on how to actually have that conversation with your child to tell them this news, this is something that we often provide guidance on. Because having these difficult conversations, with a person of any age is really hard, but to know for sure that you are properly relaying that information to a child in a way that they understand based on their developmental level is really some of the most invaluable work that we as child life specialists are able to provide.
Thank you so much, Annie, for all this wonderful information. If anyone has any further questions, feel free to email Annie. Her email is below on the screen. And I think that's about all that we have time for when it comes to questions. So thank you, Annie, so much. And again, this will be recorded and put up on our website, and you'll see it there. Thank you, everyone.
Thank you, Annie.
Thank you.
Thank you, Annie.